Okay, we are live.
All right, hi everyone. Welcome back to another virtual session here with Fresh Dental Shadowing. Today we have our amazing guest, Dr. Park, and he will be sharing his journey to dentistry and some interesting cases. So, Dr. Park, whenever you're ready, you can go ahead and get started.
Good evening, everyone. Thank you very much for joining us for this presentation today. I would like to thank Ayla Nabira for inviting me over to go ahead and do this presentation. So without further ado, let's go ahead and get started. So this is me. I'm Dr. Gene Park. I'm currently a second-year resident at the Ohio State University College of Dentistry in the Division of Periodontology. So I'm going to just briefly go over kind of like my journey through the educational career, and then afterwards I'll go ahead and just briefly explain the specialty of periodontology. So in terms of my educational past, I got my Bachelor's of Science in Biological Sciences in University of the Pacific. So this is in California. Quick fun fact there. So for anyone who's interested in dental school, University of the Pacific actually has a pre-dent program. So you can actually finish your bachelor's there in 2 years, 3 years, or 4 years, depending on which track you get accepted into. And then you can also apply to the University of Pacific Dental School, which is in San Francisco, and that's the only dental school actually in the United States that is a 3-year program. After I graduated from University of the Pacific, I went ahead and got accepted into New York University College of Dentistry. That's right in Manhattan, and I did a 4-year education there. Right after that, so now I'm currently a Periodontics resident, currently in my 2nd year at the university. I will also qualify my master's in science. So I'm just going to briefly go over, why I chose dentistry. So, one of the main reasons why I chose, and of course it's kind of a common reason that everyone might be interested in dentistry, is that you can actually have a pretty good impact on the community's health. You can actually be able to really benefit individuals in trying to improve their oral health and just in general their lifestyle as well. The second reason why it's because it's a very hands-on specialty, compared to kind of like if you were going to medicine or whatnot. You actually be working more with your hands compared to them. And so this could be applied to any type of portion of dentistry, which could be like aesthetics. So that can be considered really much of an artwork form. Second is the surgical fields. This also really requires delicate manual dexterity. So this is also another great reason to get into the field of dentistry. Also within dentistry, you work with a lot of dental materials, whether it be like crowns, bridges, or implants. So it has a very big prosthetic component, but also requires a lot of knowledge in mechanics. So that's another great reason to get into dentistry. This third reason is kind of more of a personal reason for me. So the reason why I really was interested in dentistry was because I really wanted to get into something surgical. And so, in addition to medicine, where you have a lot of surgical specialties that you can, apply into, in dentistry, you have various surgical specialties as well, specifically oral maxillofacial surgery or the field of periodontics. And so these surgical specialties, if you're ever interested in it, it's also another great reason to go ahead and get interested. The fourth one is human interaction. So, as a field that gets involved with, the community health, you have to interact with human beings pretty much every single day. And so for those who, don't want to work in a cubicle or do like a cubicle type job, this is a really great career to get interested into, just because you do have to interact with individuals every day, like I said, and you really have to be able to kind of build up that skill, just because it's not only about the dentistry or anything about your clinical skills. It's like you have to have the patients trust you. And so in order to do that, you really have to work on, how you interact with them, how to gain their trust, and ultimately get them to go through with the treatment plan. Another is that there are tons of leadership opportunities available, whether it be at like the national level. You have American Student Dental Association, which is associated with the American Dental Association. So there's various leadership opportunities there. There's also leadership opportunities at the state level. So whether you're interested, if you're in California, they have the California Dental Association. New York, you have the New York State Dental Association. And pretty much every single state has their own dental board. And so there's various opportunities there to go ahead and get involved. Community service is another great reason to get into dentistry. So, as one where we have, such a great ability to improve the lives of, of people in the country and trying to improve the health of the community. There are various community service activities that you can do. This could include going to like the local public high school, elementary schools to education, to educate them, on how to improve their oral health. But also, you are able to actually use your clinical skills as well. I know a lot of providers who will do like a free dentistry day like once every month to try to provide reduced or free care for individuals in their community, just kind of as a volunteer service. And so, with the great skills, we have a lot of opportunity to kind of help out the community. And also another great reason is that there are multiple career paths. So it's not that, once you become a dentist, you're going to always be a physician. There are also a lot of different ways you can utilize your degree. So, in addition to being a clinician, whether it be working in a private practice, working for what we call DSO, which is just corporate dentistry, there's also, you can have a career path in academia. So there are a lot of dentists who will choose to kind of work in various academic institutions, such as like, the dental schools are all around the country, and you can actually become a teacher. And through that, you're able to really contribute back to the field. And so it's another great career path to go into. Another one is research. This kind of goes hand in hand with academia, just because for a lot of people who do go into academia, research is kind of a big component of it. So whenever you join a university full time, they usually give you the opportunity to kind of run your own research lab. And this is kind of a great opportunity for you to kind of contribute back to the research community and trying to improve the field and trying to improve our knowledge of what we know. One is public health. So I know a couple people who went into the, and this is, kind of the field in which you will go out and try to really, not only analyze kind of the health discrepancies that may be going on in the country, but also worldwide. And so at this point, you can go ahead and analyze that data and try to create an action plan that will be able to kind of improve the general overall health of the community, to kind of improve the infrastructure so that, people will have better access to care. The last one would be forensics. So forensics is kind of a very interesting part of dentistry. And this is not, in a sense, kind of like forensics in terms of speech or anything like that. This is more of a criminal forensics. So for those who've, watched any type of like television shows like CSI along those lines. So a lot of dentists will decide to go into there where they'll kind of participate in criminal investigations. And at this point, they will kind of, use records to try to identify, victims. And this will be able to kind of help a lot of enforcement agencies to be able to identify and trying to progress investigation. So applying to dental schools, I want to add this slide for those who are currently in high school, or they may be kind of in undergraduate college and interested in the field of dentistry. So just a little plug here. Like I say, University of the Pacific is kind of where I went to undergraduate school, and this is where I really began my journey. I pretty much knew since high school that I was going to go into dentistry, so at that point, I kind of had the opportunity to really look into programs that were really tailored to dentistry. University of the Pacific is one such program that has this type of tailored focus, and so it's called the pre-dental track. And like I said, they have what we call a 2+3, 3+3, or a 4+3 track, which meaning that you do 2 years of undergraduate, or 3 years, or 4 years, and then 3 years of dental school if you decide to go to the University of the Pacific Dental School. In addition to kind of, figuring out, what type of undergraduate school you want to go into, once you actually finish undergraduate school, you have to meet certain requirements in order to be eligible to apply. And so the main important thing is having the prerequisite courses. This is going to be important for people who are not in these tailored pre-dental tracks, just because you have to be able to take these prerequisite courses. The pre-dental tracks will already have these prerequisite courses already intrinsic to the program, and so there's really not much, a la carte shopping, as you can say, that you need to do. But if you do go to an undergraduate college in which they don't have these tailored pre-dental tracks, you have to really kind of research the various dental schools around the country, just because each dental school will have different prerequisite courses that they require. And so if you want to be eligible to apply to these colleges, you have to really be certain to, research what type of courses that they require and be able to take those during your undergraduate career. The second most important thing would be your DAT score. So this is the test that will be used for admission into dental school is very similar to the SAT, except that it is used for applying for dental school. The DAT score is quite important to try to be, to increase your chances of getting into dental school. So I always encourage people to try to get the highest score possible. And of course, if you're not able to, do well the first time, I always tell people not to give up, just because, the more you take it, the greater chances you do will improve. I personally had to take it 3 times over, so it's not, a shame to, thinking that you have to get a high score the first time. You really want to try to improve that to improve your chances. The third thing that will be important for applying to dental school, of course, in addition to your scores and your testing, is going to be your extracurricular activities. So a lot of schools, they're not only simply look at your numbers, they really want to look for individuals who are well-rounded, who will want to get involved with the community, and who will make a difference in the professional field. And so a lot of times they're looking at what type of extracurricular activities that you're doing. Some personal ones that I did, research is usually a pretty big one, just because even in dental school, and especially if you decide to specialize in the various fields in dentistry, research is a fairly big component. So to be able to get some experiences in this kind of shows the colleges that you know what is expected of you in the future, and also that you have some experience in something that people in dentistry should try to get involved with. The second thing I was involved with was Alpha Chi Sigma. So this is a chemistry fraternity, actually. And this was a pretty big one for me in undergraduate school, because it really gives you kind of that social network to really talk with other individuals who are interested in the same field, gives you that support network so that if you're ever struggling in anything, that you have individuals, friends that can help you through it. The pre-dental club, if it is available at your undergraduate school, is get involved as well. They give you a lot of opportunities to kind of, shadow, to go to seminars, presentations. I will kind of expose you to more of what the dental field is about. That way, if you're sure about whether you want to join dentistry, you can be able to get some more of that knowledge, some more of that exposure to kind of cement that interest into the field. The fourth one that I did was the Club Scope. And so Scope kind of stands for Student Community Outreach for Public Education. So this was a club that was available at my school. It was one that I actually started. And the purpose of this club was really to go out to the various communities and to the various schools that are available in the community to really kind of educate the public about oral health, but not just oral health, but also various other medical topics, such as trying to live a healthy lifestyle, diet. That way you can be able to really contribute back to the community. And also it demonstrates the various colleges that that's something you're interested in and something that you would be like to do in the future. Another one is CDA Care. So in California, they have this event that goes on annually. California Dental Association basically puts on this event where it's open to the public, where people can come by and try to get some free dental care. And by being able to volunteer in something like this as well, it also shows that you want to be involved in organized dentistry. And that way it also demonstrates that, you care about the community, that not only do you just want to be a dentistry for the sake of being a dentist, but also to try to make an impact. Another one was Kiwanis International. So this organization is really a community service organization. It's a great one. I do highly encourage everyone to kind of look it up and maybe get interested in joining, just because they're kind of one of the largest community service organizations in the world. Some of you might be familiar with some other organizations, like Lions Club. These are all great organizations to be able to kind of make an impact in other ways besides dentistry. Another important extracurricular activity is really to job shadow. So a lot of individuals will kind of just like slightly research dentistry and try to make a decision there. But I highly encourage everyone to really go deeper, to really kind of go around to various dentists and ask to shadow what they do on a daily basis, because sometimes dentistry is not only about doing the actual clinical work. There are a lot of facets involved with the dental field, especially if you're in a private practice, because there's a lot of business components. Like I said, you do interact with patients every day, so you want to make sure that that's something you want to do. And also about the various procedures. So a lot of people think that dentistry is just about fillings, or making crowns, but there are a lot of other procedures that are involved with dentistry, so it's very important to kind of know the scope of the field. What to look for. So I always say when you're applying to dental school, you should really apply wide. I really do discourage people who try to say I only want to go to a school in this state. I always say don't try to narrow your opportunities, but instead try to apply wide. There are fantastic programs all over the country. And also by going to a different place, you really do kind of expand your experience as well, and kind of experience more of what various geographical locations have to offer. Another thing to really look for, I say, is cost of tuition. So this is going to highly emphasize, just because right now at this point in time, the dentistry is kind of going through a change where, in the past, going to dental school and getting an education used to be quite cheap. But nowadays, we're seeing this exponential rise in the cost of tuition. And this is leading to, this huge problem with student debt. And so when you're looking for various colleges to apply, this is also another reason to apply wide. You should really focus on the cost of tuition. I always encourage people to try to, get into a school with a low cost of tuition. Not only will this help you, once you're in private practice, kind of to open your own business, to kind of have less stress, but it also gives you, more of an opportunity to apply for a spec because those costs as well. And so you really want to delegate how much you're going to be spending. Another one is going to be location. So location is also very important. Every different dental school is, like I said, located in different geographical areas. But because of their geographical areas, sometimes it lends you to a different experience. This kind of ties into the patient pool. And so, for example, if you were to go to a dental school in kind of a big city like I did in New York City, the patient pool is enormous. And so because of that, we were able to get a lot of experience. And so that's something that you might want to research as well. Another thing is going to be clinical training. This is going to be quite important as well, just because you are going to a dental school, you want to get the best education as possible, and so you want to research to see what type of training are they providing. Every dental school will give a certain standard of training as required by the American Dental Association, but there are some dental schools who will kind of go above and beyond and kind of give you extra training. For example, at New York University, they're able to provide what we call honors programs, for example, in any type of special field, such as periodontics, facial surgery. And so sometimes, the school, if you're able to do those programs, will allow you to do procedures that you normally aren't supposed to do in dental school. So that gives you that extra training. Right now, a lot of general dentists are placing implants, and so there are some schools that will give implant experiences. And so that's also something that you might be interested in looking into. The next one is going to be faculty to student ratio. So this really depends on what type of individual you are. So if you're the type of individual who really loves to learn from, a faculty, really wants to have that hands-on teaching, then you want a really good faculty to student ratio. So that way you will be able to have a lot of exposure to the various professionals that are at the school, so you can kind of pick their brains and really learn a lot from them. Some students are able to really kind of learn on their own, and so if that's the case with you, this might not be too much of an important factor. Another one's going to be research and leadership opportunities. So certain schools compared to others might have a bigger research component. They might have better funding, and so they might have greater labs that would be able to provide greater opportunities for students to join. And so if you're really interested, especially if you're interested in joining the academia career track, then research is going to be a very important aspect of it. In addition, if you're really interested in specializing, research is going to be very important as well. So if you are interested in specializing, then I would encourage that you look into dental schools that provide a lot of research opportunities for dental students to participate in. Leadership opportunities is another one. So like I said, some schools compared to others might have greater leadership opportunities. For example, at mine, we had a student body in which you could, become like the president, try to plan a lot of class activities. Also, some schools compared to others might have, greater amount of clubs to participate in, or they might have an administration that's a lot more easier to work with in terms of starting new clubs or in terms of planning new activities. And so this will be something to also look into. So in terms of my journey during dental school, so I went to the New York University College of Dentistry. So fun fact, this is the largest dental school in the country. Interestingly enough, we have almost about 400 dental students per class now. So that's kind of a total of 1,600 for an entire one. New York University is kind of unique in this case in which they can do this just because they're situated right in Manhattan. And so the patient population the pool is rather large, so they're able to, accept these students and still have a good amount of experience. Another one is to take advantage of all the available opportunities. This is going to be very important, especially since dental school is getting so expensive now. You really want to maximize the experience that you're getting at these dental schools. So whether it's research, whether it's joining clubs, or whether it's doing some extracurricular, extra clinical work that's available for you, I highly encourage everyone to really, get busy during dental school. That way you can try to garner as much experience as possible. So for those who are interested in specializing, there is a plethora of specialty fields. The most basic common ones would be, prosthodontics, which is basically the specialty in crowns, dental fillings, complex, full mouth rehabilitation cases. So they're kind of what I call like the super general dentists. The second one is periodontics. So this is a specialty that I'm currently in. And the specialty of periodontics is really related to kind of the gum, the bone. So everything that surrounds the teeth. It really lays the foundation for any type of dental health. And also it's quite heavy in the surgical realm. And so for those who are interested in that, it's a great field to look into. The third one's endodontics, for anyone who's heard of root canals. So they're kind of pretty much the specialty in that. So they really do focus on kind of the roots, the nerves of the teeth. And it's a great specialty as well. So I really highly recommend looking into that as well. Pediatrics is also becoming a very popular specialty in the field. So pediatrics is a specialty in which, you focus on kids. The reason why this is a, important specialty is because children do require a separate approach, a different kind of approach to the way that sometimes they can behave. And so in pediatrics, it's really important that, people get into this so that they're able to handle them as well. But also because the dentition, the teeth that children have is different than that of the adult teeth. And so therefore it does require different treatments as well. Oral surgery, it's another great specialty to look into. So this is probably the major surgical specialty in dentistry. So here, not only do they focus on oral surgery, so anything within the mouth, they also focus a lot on the face as well, which is why their full name is actually oral and maxillofacial surgery. They probably have one of the biggest scopes of what they can do, just because they can also qualify for getting their medical degree. Orthodontics is one that most of you are familiar with. So this is, the specialty of braces. So kind of moving teeth around to try to get a harmonious occlusion. Anesthesiology is a specialty that focuses on sedation. And so sometimes a lot of patients will have some dental anxiety. So whether it's because they were, has some type of trauma in the past, or sometimes because they might have some mental condition that really prevents them from undergoing dental procedures calmly. Anesthesia has become very big to kind of, put them to sleep so that you can be able to do any treatments necessary without endangering the patient. Public health was kind of a field that I touched upon earlier, where you really want to analyze kind of of access to care, whether it be in the country or in the world, and you try to address those issues with an action plan. Oral facial pain is another specialty that focuses kind of on as it says there, oral facial pain. So sometimes, pain kind of in the oral facial region is not really related to the teeth. It might be related to, something else like the nerves or the muscles. And so these are the specialists that really get a really good understanding of that so that they're able to help their patients kind of get out of pain. Oral medicine is another great specialty. This kind of ties into radiology as well. And so a lot of the times patients will have some sort of pathology, some sort of disease process that may be going on, whether it be like a cyst, an abscess, some type of odontoma, cancer as well. And so radiology, they will look at kind of the x-rays. They'll be able to identify and diagnose it. And then oral medicine, they'll be the ones to go ahead and prescribe any type of medication that might be help with those processes. So in terms of specializing, there are a couple of things that you have to kind of really look into when you're in dental school. The main important thing I would always say is your GPA and class rank. I say that, the numbers is what really gets your foot in the door. And so to really, to try to be very studious, try to, get the highest GPA and class rank as possible. And in addition to standardized testing. So standard testing, for most specialties, it's not required actually, but some programs will require you to take what we call the ADAT. It's just the advanced the DAT. And so if that's the case, then that's something you really want to study for and try to get a high score as possible. For those who are interested in oral surgery, there's something called a CBSC test. This is basically the part one of the medical boards. And so the reason why this is important is because oral surgery, you do need to, or there is an option to go ahead and get your medical degree in a 6-year program. And so they really want to ensure that you're able to pass that on medical boards. And so that's why they do require the CBSC. Of course, like I said, testing, although it really does, testing in numbers really does help to get your foot in the door. It's not everything. If you don't get, a grade or like a perfect GPA or a perfect standardized testing score, it's not the end of the world. Have any of the other components to kind of apply, then you still have a chance of getting in. One of the components would be research. And so a lot of schools require research in their specialty program. So as a result, they want to see individuals who have a bit of experience in it. Another one's going to be leadership and extracurricular activities. And so when you're going to a specialty program, a lot of the times you are kind of the expert in the field. And as the expert in the field, sometimes you'll be required or expected to kind of give seminars, presentations, but also to lead some organizations or to kind of help the general dental community to kind of learn more about your field in specific. And so by getting involved in leadership or extracurricular activities, you're able to demonstrate to the admission board that this is something that you're capable of and something that you would be able to do if expected of. The last thing that's going to be very important will be your letters of recommendation. And so, the admissions board, when they look at your application, all they're really seeing is numbers and kind of the list of all these activities you've done. But sometimes it's very hard for these admissions committees to really know, what type of person you are, how, you conduct yourself in school. And so the letter of recommendations is a really important way for them to assess you in that way. As a result, so when you are in school, it's going to be very important to try to, create these connections with your faculty members, with admissions, with the administrative faculties, but also in addition to like your research or sometimes the community members that you might be involved with, community dentists that you might be shadowing. That way you have a good list of people to approach when you need a letter of recommendation. So some personal examples that I have done in dental school in terms of, what I try to do to make me stand out. The first thing was research. So this was something I was very interested in, knowing that I want to specialize. And so I did a lot of research when it came to like dental implants, 3D printed scaffolds for bone regeneration, just because I knew I wanted to go into a surgical field. So I really tried to find a research lab that had this type of focus. A second thing I did was an oral maxillofacial surgery externship. So originally I was interested in oral surgery, and so I did an externship at a hospital. And this, gives you a really great experience. There's other externships available for various specialties as well. So it's kind of more of an intense type of job shadowing, where you kind of go in. You also actually are expected to do some work as well. The third thing is job shadowing. So I did go around a lot of various dental clinics, private practices, corporate dentistry places to really shadow, what is the day-to-day activity that they do. That way I can really, ensure, cement that this is something that I want to do, but it also demonstrates to the admission board that, after exploring everything and actually knowing what everything entails by the specialty, that it is something that I'm really highly interested in, and it kind of demonstrates that of my high interest. The next one I did was I was a teaching assistant. So a lot of dental schools will, have this opportunity where, once you're in your fourth year, you can go ahead and teach kind of the underclassmen, various, whether it be didactics or whether it be simulation in the lab, trying to teach, these undergraduate students these underclassmen students kind of the various skills, and also kind of demonstrates that you do have some abilities to teach. Some other things I did is a global outreach. So New York University provides opportunities for various students to kind of go abroad to various countries in the world to give some free clinical care. So in this case, I went to Cuenca, Ecuador, which is in South America. And at this point, this was a 1 week of experience where we were able to provide care, pretty much in every field of dentistry, whether it be like endodontics, oral surgery, pediatrics, or simple restorative care. And so this was a great experience because it kind of also shows kind of the lack of access to care in a lot of places and the type of impact that you can make on these communities. Another thing I did was I was president and also vendor fair chair for the American Student Dental Association. So this is the largest dental association in the country. And as part of ASTA, there are a lot of opportunities, a lot of different experiences you can garner, whether it be, trying to show and trying to educate the public about, the field of dentistry, but also it kind of gives you opportunities to kind of advocate for the field. For example, they have a lobby day where you go whether to the state capital or to the national capital, and you can actually lobby on behalf of the American Dental Association and really try to get lawmakers to pass laws that are in favor of not only you as a dentist, but also in favor of trying to improve the oral health of the community. The last thing I did was give kids a smile day. So this is a national event that happens where you're able to kind of not only educate, once again, kind of kids on how to improve their oral health, but also be able to provide some dental care for them as well. So going on to what is periodontology? So this is the specialty that I decided to get into. So this is a specialty that studies supporting structures of the teeth, as well as the diseases and conditions that affect them. So they specialize in pretty much the prevention, diagnosis, and treatment of periodontal conditions, in addition to the placement of dental implants. So this requires 3 additional years of training after dental school. This is a great field, like I said, just because one, periodontitis, is a disease that affects, a great portion of the population, especially nowadays in which, we have a diet that sometimes will be able to cause this disease, but also, a lot of the prevalence of such as like diabetes, which kind of increases the risk factor of getting periodontitis. And so this is becoming a very prevalent disease that really needs attention. So why periodontology? So periodontal health is a prerequisite to a healthy dentition. So, there's really no point in doing a filling or putting a crown on our teeth if your periodontal health isn't good. Just because, you could create a great teeth, but if the foundation isn't great, then the tooth will pretty much just kind of fall out on its own. The second thing is that health is linked to systemic health. So in periodontology, there's been a great surge in research in terms of the link between dentistry and medical health. And so what this means is that essentially it's been found that, periodontitis can actually sometimes, increase your risk of heart disease. It's also been found that diabetes is a great risk factor for the development of periodontitis. And so it really shows that, what you do in dentistry can actually affect your overall systemic health. And so this was a great reason to get into periodontology because you're able to kind of bridge that gap. A third reason is, human interaction and patient education. So, me personally, I really don't want to be one of those individuals who kind of like a cubicle job where they don't really interact with other humans. And so I really enjoy, able to talk with individuals, to have fun, engaging conversations, and also to really educate them. Because a lot of the times, patients will grow up learning how to do things one certain way. And then once you, are able to really interact with them and teach them, you're able to really make a difference. Next one is high contribution to research. So, the field of periodontics is probably one of the specialties that contributes the most to research, not only to to the disease of periodontitis, but also to the field of implantology. And like I said, also this field of linking oral health and systemic health. So for those who are interested in research, this is a really great field to get interested in. These last 2 ones are probably one of the greatest reasons why I decided to join periodontology. The procedures are extremely interesting, and it requires really delicate manual dexterity. So like I said, in the field of periodontology, there requires a lot of surgical procedures. So those who are interested in surgery, this is a very interesting field to get into. But also surgery requires, really fine manual dexterity skills. So, I know there are certain individuals who love to work with their hands, who are very artistic, who are very mechanical. This is a field that does require a lot of that as a prerequisite. So it's a really great field if you're interested in those type of things. And also, we also do get moderate sedation training. And so, by being a periodontist, not only are you able to do these really cool, interesting procedures, but you also get a lot of training in sedation. And this, it kind of helps a lot, especially when you're dealing with a patient population who's very anxious, or like I said, have many medical conditions that prevents them from undergoing any type of dental procedure. By having this moderate sedation training, you're really able to provide a service to the patient so that they can get the care that they need. So the resident lifestyle. So, the great thing about periodontology, is that you have a really good work-to-life balance. So, in my residency, we have work hours from pretty much 8 a.m. to 5 p.m. Monday through Friday. And pretty much after that, there's really not much else to do but, try to enjoy your life, be able to, try to get a good lifestyle afterwards. So it really is a really good work-to-life balance. In general, we have clinic about 4 days a week. So for me, it's Monday, Thursdays, and Friday. And that would be, like I said, from 8 to 5 p.m. Teaching also happens one session a week. And so a lot of these specialty programs will require you to teach the pre-doc dental students. And so for me, it's one session a week. So whether it's one morning a week or one afternoon a week, I would go down into the pre-doctoral clinic and go ahead and, provide teaching to a lot of the students there in terms of periodontics. The third thing is going to be research. So like I said, most programs will have a research component. And so for me, it's 1 day a week where it's dedicated for research. For me personally, I'm doing research on implant placements and also the use of surgical guides. And so this is a great experience as well, because not only do you get to know and learn about the research process, you're actually really able to gain a lot of knowledge about a specific topic by doing research on it. The other one is going to be didactics. So, as a resident, it's not as didactic heavy as compared to, let's say, like dental school, or let's say your undergraduate education. So there's not too many classes you have to take. It's usually about like 2 to 3 courses per semester. In periodontics, the specific courses that, most of them will be required for you to take is like literature review. So, reviewing the available scientific literature that's available, such as on sites like NCBI, to really kind of gain not only what the classic literature says about, how and why we should treat periodontitis, but also the current literature on, what is the newest research that's been coming out and how that can guide us in terms of what we should do in clinic. Seminars are also important. So, we will take a lot of photos of our cases and we will present them to our faculty so that we can gain feedback. Another dental photography, this is gaining a lot of popularity nowadays. That way you can document cases, get photos. So like I said, you can get feedback from your faculty, but you're also able to kind of like judge your own cases and see what you can do better. Statistics is going to be another course, just because for this, in research, you're going to be doing a lot of statistics once you get data. And so you have to kind of know the basics of it so that you really analyze it in a proper manner. Another one is pathology. So as a periodontal resident, we do get some experience in pathology. This is very because, patients will come in, we will do biopsies on these pathologies, and we have to know, how to identify them, how to diagnose it, and how to treat them. Sedation, like I said, is something that we also need to learn. And in addition, it's going to be practice management. So this is also a great course that my school offers, just because a lot of people who, once they get out of residency, will be looking for a job, whether it be in private practice, corporate dentistry, and to really learn what you should be looking for in terms of when you start to work at these places. A lot of programs will also require that you're on call. Some places are more intense than others. Luckily for mine, it's not too intense. For me, I just have to be on call 1 month a year. Some places will require you to be on call at the hospital, while some won't require you to do that. So it's also something to look into when you're trying to apply for these places. So this is probably, what you guys are really looking for. What do we do in the field of periodontics? What are the actual specific procedures that we are involved in? So I'll try to, really give a comprehensive summary of what we do. That way you guys can have a good understanding of, what we usually do day to day. So, the first one are going to be periodontal procedures. So these are procedures that are tailored towards treating the disease of periodontitis. And periodontitis, like I said, is really the disease of the gums and the bones that surround the teeth. And so usually it starts out as gingivitis, which you guys probably have heard. It's where you get a lot of plaque accumulation around your teeth and your gums start to swell, get inflamed. Usually patients will sometimes get a lot of discomfort. When they floss, they'll notice a lot of bleeding. But the moment that plaque and bacteria travels underneath your gum lines and gets near your bone, that's when you start to get what we call periodontitis, where your bones start to get infected. And so what happens is the bone starts to essentially recede, you start to lose bone. And after a while, your tooth will start to wiggle, will start to move. And this can be, very dangerous, because then, if you allow this disease process to get really advanced, then eventually the tooth will essentially just fall out on its own. So the first and kind of like I would say the bread and butter of what we do is what we call scaling and root planing. And this is a procedure in which, we really clean the teeth well. Crown lengthening, is a procedure in which we try to extend or expose the tooth crown as much as we can. Gingival flap debridement is just a procedure in which we open up the gum so that we can get better access. We can see the entire roots of the teeth to clean it. Osseosurgery is kind of just like recontouring the bone so that it's more like a normal shape. Guided tissue regeneration is kind of the concept in which Are you guys able to see me once more?
Oh yeah.
It's all good. Yeah, I apologize about that. Should I continue?
Yeah, go ahead. Share your screen again. It's still on. Yeah.
Okay, perfect. Yeah, I apologize about that. So continuing, so sometimes, after all these periodontal procedures, sometimes it's not possible to save a tooth. And so in that case, we need to be able to replace the teeth. And so we do a lot of implant procedures. And dental implants are basically just metal posts that we put in that can act as a support for, a prosthetic crown. Guided bone regeneration is basically just regenerating the bone so that there's enough bone to be able to hold the implant. And the sinus lifts are basically the procedure to try to lift the sinus if there isn't enough space for bone. We have to lift it in order to create more space, regenerate more bone. And then peri-implantitis is kind of this disease process where, bacteria accumulation may happen. There might be other factors that might cause implants to fail. And so as a result, as professionals, in this type of procedure, we have to know how to treat these complications. Some miscellaneous procedures are kind of like extractions. Phonectomies, which is basically the webbing that you might see kind of, on your bottom lip, top lip, that can kind of restrict sometimes patients who can, but also sometimes it can cause recession as well. So sometimes we have to remove it. Lip repositioning, some people, when they smile really widely, a lot of their gums show, so we call it gummy smile. And so we can reposition the lip so that it gives a more of an aesthetic appearance. Root amputation is basically the procedure in which sometimes, for example, the molars, your upper molars, they have 3 roots. And so if 2 of those roots are perfectly healthy, but one of them isn't, we can actually just amputate one of the roots so that you're able to keep that tooth without, completely removing it. Periodontally accelerated osteogenic orthodontics. So this is the procedure where you have to work in conjunction with an orthodontist to really, and this procedure kind of helps to accelerate the timeline. So usually, orthodontists can take between like 3 to 4 years to really move the teeth well, but sometimes with this procedure, we're able to cut that down to 1 or 2 years. Canine exposure is kind of the procedure in which some people are born in which their canine teeth doesn't fully erupt, so it doesn't come out and show, and instead it just kind of hides out in the bone. And sometimes we want to expose that just because, they may have enough space to kind of pull that canine out. So this is another procedure that we do in conjunction with an orthodontist. And like I said, we also do have training in pathology. And so whenever patients come in with weird lesions in their mouth, we may want to biopsy them because sometimes they can be cancerous, or sometimes they'll be benign lesions. And so we really need to be able to biopsy those, identify, diagnose it, and then treat it. And then, like I said, also anesthesiology. So we do get moderate IV sedation training for those who are really anxious. So I'm going to go a little bit more in depth into some of these procedures just so you guys can have a better understanding. So this is where I talked about scaling and root planing. And so, plaque accumulation happens a lot right here, kind of near the bottom of the tooth. And so that's really what initiates a disease process of gum inflammation. And then also here, you can see that plaque will kind of get lower, lower, and lower. It will migrate. And the moment it gets next to that bone, it will essentially start resorbing the bone, and you might lose a lot of that bony support, and so the tooth will start to wiggle and fall out. So the first, the picture on the left depicts non-surgical scaling and root planing. So these are people for, who, it's what we call initial therapy. We do it to see how they respond. Sometimes, they've lost so much bone and they have, these huge pockets that are not accessible with regular non-surgical scaling and root planing. And so to really be able to clean out the entire root surface, 100% perfectly, we have to open up the gums so that we can see the entire root surface and clean it really well. So this is osseosurgery, so I hope none of you are too squeamish. So this is basically a procedure in which you can see on the top left, bone architecture, because of the periodontitis process, the bone gets a really weird shape. Basically, I kind of call it like bacteria chewing out these weird shapes in the bone. And so, when that much damage has been done to the bone, we have to correct it. And so we open up the gums, right? We expose the bone to see what we're looking at, and then we'll go ahead and recontour it with one of our instruments so that we get our harmonious shape, which can be seen kind of on the bottom two pictures. So you can see it's a lot smoother, and a lot of those indentations and crevices are now gone. And the reason why we do this is because when you have a lot of those crevices or those indentations, it kind of acts as like a cave, a hiding spot for bacteria to hide out in. So another one is going to be regenerative surgery. So in this picture, you can see in the top left that they have lost a lot of bone right here. You can see, there's like this little divot. And so sometimes with these type of defects, of what we call them, we can actually grow the bone back. And so on the picture on the right, top right, which is B, you can see kind of like they filled it in. And so we will use bone particles, whether it be from like cadavers, it could be from animals, and then we kind of fill it in. And at that point, we will put, what we call a membrane. And this is essentially like made out of like collagen. And we kind of place it over. I kind of like to describe it as like a roof for the bone graft so that it doesn't kind of fall out on its own. And then we close the gum up and we let it heal. And so this allows the bone to kind of regrow. So this is kind of a pictorial a case that kind of shows it as well. So, on the top left, you can see the bone should be completely straight along the lines, but you can see these divots because of periodontitis. And on the B, you can actually see that on the actual photography here, where you have this V-shaped defect. And so we'll fill it in with bone particles, as shown in C. And then in D, you put the membrane over it so those bone particles won't kind of fall out on their own. And then we close it up. And you can see, difference between the X-rays on the top left and the bottom right, where we're able to grow that bone back, and that helps to strengthen support of the tooth. So crown lengthening is a procedure in which, that can be done for various reasons. On the left-hand side, sometimes when the restorative doctor, which is like the general dentist, wants to put a crown on top of it, they have the crown margin has to be a certain level from the bone. And so if there's not enough tooth structure to be able to put a crown on, we have to kind of remove some of the bone around the teeth to kind of expose more of the tooth structure so that the general dentist can put a proper crown on. Some patients are also bone, which is an excessive amount of bone just naturally when they're born. And so this sometimes can kind of create a short crown look. And so sometimes it's not aesthetically pleasing. And so in that case, we can remove some of that bone, expose more of the tooth is more aesthetic. phonectomy is just a procedure in which we kind of just cut off the excess amount of soft tissue, the gums that a patient has. Sometimes this could be genetic, sometimes it could be due to medication, sometimes it can be due to some medical conditions. And so if that's the case, on the left you can see that having a lot of this gum or the soft tissue available in really short crowns, it just doesn't look as nice. And so then once we kind of cut off those excess tissue, you can see on the right, it just looks a lot nicer. Implant placement is just like I said, if we're unable to save the teeth, which happens on occasions, then we have to be able to replace it. So on the left-hand side, just kind of depicts the process of it, in which we just kind of open up the gums, we drill into the bone to create what we call an osteotomy. It's just basically a hole to put the implant in, and then we screw the implant in, and that implant serves as kind of a foundation for the general dentist or the restorative doctor to put a crown on top. Sometimes some patients will have completely no teeth at all, and so then we would have to place multiple implants. So here on the picture on the right, it shows 6. That way we can go ahead and hook on a complete denture onto it. So the next one's going to be guided bone regeneration. So this procedure, is done when there isn't enough bone support. So, the screw, the dental implant, needs to be completely surrounded by bone. And so on the picture on the left, you can see they have a very thin ridge. And so, if we're to put an implant in there, there wouldn't be bone surrounding the entirety of it. And so then we have to kind of augment it, is what we call it, to try to bulk up the amount of bone that's available. So we will, open it up, we'll put a bone graft in, right, kind of shown right here, and then we'll close it back up. Once that's done, we'll get something that's shown on the top right. So you can see that width is a lot bigger than compared to the photo on the left. And this gives us the proper amount of space in order to put an implant in. So a sinus lift, sometimes patients, their sinus is kind of located right here. And so over time, sometimes the bone will either resorb and the try implant, for example, on a picture on the top, you would literally put a screw right into their sinus, which wouldn't really be fun for the patient. And so what we need to do is then we kind of, open up, that area shown on the top middle photo, and then we'll kind of lift that sinus up, shown on the top right, to kind of create this space so that we can go ahead and put bone part shown bottom left. And then after it heals, we get something that's shown on the middle bottom, where now we have the sufficient amount of bone so that we can put a dental implant in. Canine exposure is like a procedure that we do with, like I said, with orthodontists, and we basically just kind of expose the canines that are kind of hiding out in the bone, and that way, the orthodontist can go ahead and put brackets on it and just kind of bring that tooth downwards. Periodontally accelerated osteogenic orthodontics, like I said, is a procedure that can be done to accelerate the timeline for moving teeth. And so we essentially just open up the tissues. We'll kind of make these indentations between each of the teeth. That way the bone will have an easier time moving. And so this is kind of depicts that. Lip repositioning. So like I said, on the right photo on the bottom, you can see when they smile, they show a lot of their soft tissue, their gums, and so we call this gummy smile. And so a lot of times patients don't like it because they don't think it's aesthetically pleasing. And so we'll do something called lip repositioning procedure, where it shows on the left-hand side, where we'll kind of get rid of some of that excess tissue, and we'll go ahead and also kind of like excise some of that muscle attachment so it doesn't pull on your lip so high. And then once we finish that procedure, we get a kind of a result on the right top, where the lip is exactly where we want to be and it's aesthetically pleasing. So this is the last kind of part of the presentation. So this will be a case study. So this is a case that I did during my residency. So this is soft tissue augmentation with a phonectomy. And so you can see kind of here the patient on this bottom tooth right here. You have this huge amount of plaque accumulation, which is kind of one of the major causes for gum recession. But also the patient reported that she was really brushing, really hard, like side to side, up and down. And so that can also be another cause of recession. And so, that's why we always, advise our patients to, use a very soft toothbrush to, brush the circular motion rather than side to side and up and down. And so, because of this recession, the patient was having a lot of sensitivity when she was drinking something cold. And also, when she smiled, you can actually see this recession. So it wasn't very aesthetically pleasing. Another cause for this recession for this patient was that she has this huge frenum on the bottom part. So I'm kind of highlighting here with my arrow, where it's kind of a webbing. And this webbing will kind of pull on that tissue downwards, and it will cause that recession to happen as well. So we needed to remove that with a procedure, which was phonectomy. Here, this is, a showing kind of where we get the soft tissue graft, right? Like we need to have in order to kind of replace the tissue that was lost. And so we usually take this from the palate, so from the roof of your mouth. So we'll go ahead and, make an incision. We'll kind of take it out. This procedure actually requires, a very good amount of delicate hand skills, because you also have nerves and you have a blood vessel that runs in this area. So you really don't want to nick that. But once we go ahead and remove it, we'll go ahead and suture it close. And then this is kind of the graft that we get, right? So this is the tissue that we're able to remove and harvest from the palate. So once that's done, we go to the area of the recession. We really need to clean it well so that the surface is very clean and hygienic, so that the tissue can attach to it really good. And once we do that, we go ahead and place the graft right on top of it. All right. We suture it, very tightly to the tooth, and also to the tissue, so that the graft doesn't move too much. Once that's done, we go ahead and close it up. Then this is pretty much about like 2 weeks after the procedure. You can already see, the significant amount of tissue that we were able to gain, and that recession is almost pretty much not there. But you do notice, that huge frenum is still pulling on that tissue. So this was the time in which we decided to go ahead and relieve that, to kind of remove it, so it wouldn't cause a relapse. So this is kind of the photo that we did for the phonectomy. We just make a single incision, we pull it down, and then that way we go ahead and remove that big webbing that's pulling on that tissue, so that the recession doesn't happen again. And this is pretty much the healing, once again, about like 4 weeks after the procedure. So you can see that webbing in the middle is pretty much gone, and that recession that used to be all the way down here, we're able to kind of regenerate that tissue all the way up back to its original level. And after 4 weeks, the palate heals amazingly quickly. So that really ugly, really painful looking incision on the top just heals super quickly. Patient actually doesn't have too much discomfort. They really just kind of describe it as like having a pizza burn for about like 2 to 3 weeks. So here, this is the before and after. So you can see on the left, the big webbing that's seen, and also the huge amount of recession. But pretty much after 4 or 5 weeks of the procedure, patient has a pretty much, almost perfect result with that webbing not there anymore. So we really increase the chances of it not happening again. And that is it. Does anyone, and then, I guess I'll open this up for any questions that anyone has.
All right, thank you so much for that amazing presentation, Dr. Park. It looks like we have hit that hour. Thank you again, Dr. Park, for doing this presentation for us today, and for everyone for tuning into the session. And just a reminder, go ahead and do that quiz so that you can receive the hour of shadowing. Once again, thank you, everyone, and have a good one.